All right. I stopped here because this is probably a good place as ever to stop and continue my update. Today's Saturday, August 13th. I feel good. That's relative. I feel way better than I felt the last 2 weeks. But really, the last 2 weeks was really uneventful. Nothing really happened. I did have a follow-up with my doctor. My labs continue to trend back to normal. I started antibiotics designed to prevent any type of opportunistic infection because I'm low on lymphocytes that fight viral infection, because we don't want any type of viral infection turning into something that affects my lungs, right? And then it become bacterial, right? Infection. I mean, because you have all types of opportunistic infections that can happen when your immunity system is low. And I have low lymphocytes. So I'm on a course of antibiotics. And my lungs are healthy. When doctors listen to my lungs, all they hear is air. They hear nothing else and just huge volumes of air. And I think that's because I've been riding a lot and just training. So definitely, lungs are key. Aerobic capacity is key. Just having that type of a system that can respond to things that go wrong in your body gives you a leg up on the war that all these bugs that you're fighting. So today's day 25, day plus 25 days after my T-cell infusion. And for those of you who didn't watch my previous updates, I am enrolled in a clinical trial. It's an anti-Claudin18.2 T-cell therapy, and the hope is that my T-cells that were genetically modified to fight my particular disease, which is pancreatic cancer. I have tumors in my right lung and in my liver area. And the hope is that the re-engineered, modified T-cells will attack my cancer. And so I've been tired the last 2 weeks. There are times when I literally could just not get off the couch or out of my bed, but I had to force myself to get out. And so I think I only rode, I think 30, 40 miles this week. Yeah, you definitely got to fight through it. And this morning, I felt really good. I haven't had labs recently. Last time I checked, my red blood cells were, I think, down to 3.8, which is below the low. I think low for red blood cells is like 5, and I'm at 3.8. And I think any lower than that for me, I know they were down to 3.4 once, and I literally couldn't walk from my bed 20 feet to the hallway without having to lean against a wall, because I was about ready to pass out. And if I didn't pass out, I was so tired I couldn't stand. But I think if you have good cardio, sorry, I'm just batting away these gnats, I think, mosquitoes, whatever they are. You can train your body to function at a really low red blood cell hematocrit. What are the red blood cells? You got red blood cells, there's the hematocrit, and then there's the what's the other one? Hemoglobin, yeah. And you could actually train yourself to function normally or even above normal, above average. But at a certain point, you can only do so much. Your body just gives out. And that's because you need red blood cells, right? Okay, so where am I? I'm rambling. Easy for me to ramble. Oh yeah, other than that, I have scans next week. And these are CT scans, high definition MRI with contrast. And these scans will hopefully reveal what the T cells are doing in my body, if my body responded or if the tumor had any type of response. And we're hoping that there is something there. But I know in 2 more months I'm scheduled for another dose of T cells, modified T cells. But what we don't want to happen is we don't want to see the tumor increase, and then we'll have to have further discussions if it does increase in size. So anyway, like I said, I can't control that. All I can control is what I can control, and that's being out here writing. And I wish I had more updates for everybody, but I really don't. I'm on a new antibacterial treatment. Again, they said that I'm susceptible to bacterial pneumonia, and we don't want that. Although I think I'll be able to withstand it a lot more than the regular person, but you never know, right? Everything's a risk, and you calculate how much risk you want to take. And I've come way too far to risk anything happen to me, especially from opportunistic infection. And if there's things I can do to take to prevent that, of course, side effects do come with that. I'll do it. And I guess some of the bacteria that I need to stay away from is the stuff that actually is found in the soil. I mean, look, at the odds of me getting that is low, but it's still pretty high because I just have compromised immune system. And so I'm looking at my water bottles now, and I'm ready to take a sip, and guess what's on my water bottle? All right, I'm heading home right now. Gonna head to the beach. It's now, I think, 7 o'clock in the morning. I was up at 5, and it's about 92% humidity right now and about 69 degrees. So, yeah, looks like I beat the heat, but I didn't beat the humidity, and it looks like I'm beating the rocks. And you don't want to fall down and possibly risk infection. So I'm not going as crazy as I normally do. So this is one of those mellow rides. And I think that's it. So I hope everybody has a great weekend. I gotta navigate this. 1 second. Sometimes you gotta use 2 hands. All right. All right. Something really funny is when you go under chemo, some people lose their hair and lose your eyebrows, and you lose your eyelashes. And what happens is that eyebrows and eyelashes prevent sweat from getting your eye. All right, I'm out, going home. See ya.